Now the machine is still going through its self-test, but the next thing we're going to do is again squeeze together on this, and we're going to push down until the bottom part of the syringe seats into this clamp down here. And you'll hear an audible click when it does that. And the machine recognizes that I have now seated that vial into the machine. And it's asking me to complete or correct the pump settings. So it wants me to go ahead and do that. So I hit the enter button, and it says it has finished that self-test, and it has a little message here that says continue. So I'm going to press that soft key. It now tells me the name of the drug, morphine, 5 milligrams per milliliter, and that is correct. If it was not correct, I would need to remove the vial and follow up on why it did not read that correctly. So it's asking me to confirm that it's 5 milligrams per milliliter of morphine, and that is correct. So the word confirm is by this soft key. I'm going to press that. Now it says clear history and RX settings, and when you're turning on a pump, you want to do that. You want to make sure that any previous history that is from another patient is removed. And typically, if the pump has been turned off an hour, that history will already have been cleared out. But we're going to go ahead and say, yes, we want to clear the history. And it says confirm that we want to clear the history and the settings, and we're going to say confirm. Yes, we really wanted to do that. Now it's asking if I want to purge. Because I'm not hooked up to the patient, I could go ahead and use this function. Purge means that the machine itself will force medication out through the tubing. And as I mentioned earlier, I could have used that function in order to get the air out of this portion of the tubing. I'm going to use it now, just briefly, so you can see what that looks like. Purge also can work to take any kind of little tension that may not be there, and because sometimes when you administer the first dose of the PCA, there's a little slack in the system, and the patient won't quite get a full dose. But if you use the purge key to take out that slack, that will. So let's say yes, we want to purge. It tells us we need to disconnect from the patient, which we are. Press and hold the purge key. It says purge there, so this is the purge soft key. So I'm going to hold that for just a minute. And the machine now is slowly pushing on the injector into the vial, and there is some medication that is coming on out into here. Once you let go of that button, it now asks, am I done? It says purge complete, and the answer is yes. I will press that. It now gives me permission to reconnect to the patient, but I'm not ready for that yet, so we'll just go on. It now asks if I want to set a loading dose, and because we're still in the medication room, we're not going to do that at this time, so I'm going to say no. Now it asks me to select my delivery mode, and there are 3 modes available. PCA only, which means the patient has a control button that they depress, that they administer medication to themselves. Continuous is also an option, which means the physician has ordered that the patient should get a continuous dose every hour. And then you can choose a third combination, which is a combination of both of those things, PCA plus continuous. Today we're just going to choose PCA only. Now it wants me to enter my PCA dose. That's written off of your doctor's orders. Our orders today are 1 milligram. So we're going to type in 1, and we're going to hit enter. Now it asks me my lockout interval. Lockout is the time frame during which a patient, once they have depressed and gotten a dose, they may not depress the button again and get another dose. And today our lockout interval is 12 minutes, so I will type in 12 and press enter. Do I want to set a dose limit? Sometimes the physician will order a maximum amount of drug to be administered over a 4-hour period. Today we're going to say no. Confirm no dose limit. Yes, I want to confirm that we do not have a dose limit, so I will press that key. Now the screen comes up and it tells me all the things that I have told it. It tells me morphine 5 milligrams per milliliter. PCA only is my mode. The PCA dose is 1 milligram. The lockout is 12 minutes. 4-hour limit, no. If that is correct, then I press the confirm key, and it is correct, so I'll press confirm. It tells me now that I can close and lock the door to begin. So I'll close the door, making sure that the tubing comes out this track and does not get kinked in there. I can turn my key upwards and pull it out. This is set up to go. The only other portion now is I have some air in the lower portion of this tubing, and the way I'm going to get rid of that is to hook up my IV fluids here in the med room. Again, the IV fluids will be connected to this short length on the tubing. Once that has been connected, then I can run my IV fluids through the tubing from here on out to the end, flushing out all the air, and I verify that by examining it. Then I can put this back into my pump. I can, if I have not, I can turn on and set the settings on the pump. Remember, we set a normal order is for 25 milliliters per hour. I can take this paper off of this tubing now so that you can see it's a long length that will match the length of the IV tubing. And so now this is ready to be taken and connected to the patient, following the protocol for that. One of the things I meant to mention but did not is that you want to observe for any leakage or damage to that glass vial when you put it into the pump. That would become apparent by some fluid leaking down into that area. We've done everything else that we needed to do to prepare, so now you're ready to proceed to the next video segment, which is entitled PCA Pump Initiation.